Hi, my gorgeous mums, and welcome to the Real Mummy podcast, where we tackle the real issues that matter to mums. I'm your host, Lucy Dalton, and today we're addressing a topic that's often whispered about, but rarely given the spotlight it deserves: pelvic health. We have a top physiotherapist with us to unravel the mysteries of pelvic health, from pregnancy all the way through to postpartum. This episode is brimming with practical advice, crucial exercises, and expert insights that will help you reclaim your body and boost your well-being. If you're ready to understand why pelvic health is the foundation of your strength and vitality, then keep listening. This is an episode every mum wants to hear.
I was lucky enough to meet you in my journey of having kids and becoming a mum, through all my continence issues after having babies. And I felt like it's just something, after speaking to other women, like it's not spoken about enough. And some women have no idea about seeing a physio who deals in pelvic health. So that's why I was really, really passionate about bringing you on and getting you to talk about what you do.
Absolutely. Getting the word out there is so important. Yes, we're a very strong brand, but we're very not well known enough. So yeah, we should spread the word.
Thank you so much. So just explain to my other mums out there. So what is it that you do that's different to like a regular physio?
So I have gone back to uni a second time and done a postgrad course in pelvic health. So I work mainly with pelvic floor and other organs within the pelvis of men, women, and children. So I've essentially done 6 years of uni just for fun.
Oh my
So an awful lot more training. So
yeah. That's crazy. So what is pelvic health? You know, you kind of hear it about, like, what's actually included with pelvic health. And like, can you give us some types of the women you would treat?
So the people that we treat is anyone. So we work it out on men, women, and children. And then bladder health is thinking of the structures in the pelvis and the health of them. So bladder health, bowel health, and muscle and kind of pain related, kind of everything that goes on down there. So the women that we treat, if we don't treat you early enough, then guaranteed we'll treat you when you turn about 60. Issues. But I love treating the pregnant women or the immediately after birth or they're within that 6 months time frame, because they are like sponges. They just love to hear all the information. They've generally looked up online of a lot of info and they come in well versed and have all their questions.
Oh, it's so good because like you said, and I actually didn't know, like I'm a nurse and I still didn't understand like that you see men as well and children, like.
Quite common. We see men particularly around when prostates come out. That's their entrance into us. And kids in terms of bedwetting and a bit of soiling in terms of constipation and or like dramas with bladders during the course of a day at school. So quite often I'll treat a mum and I'll mention that and they'll be like, hang on.
That's what I mean.
And I'll do a spiel of the kid in the corner and then treat them as well. So
that's what I mean. As soon as you said kids, I was like, hold on. Like, especially for mums out there who are listening now that might be like, actually, like, you know, sometimes they think that like it's their child that's just having issues with bedwetting, but there's actually another issue going on that you can actually help with.
I love treating the kids. They're a quick turnaround. When they gel with you, they listen quite quick and they change things quite quick. They're quite a pleasure to treat because you know that they've changed the course of their next few years.
Yeah, so, you've changed their childhood. Honestly, like it's a big thing to do that. Like,
so I guess the quick reference I give for your viewers and your listeners would be, if a kid is still struggling with their bladder after the age of 5, that's when it's seen as not quite normal. So that's when they come in and check. So when they start school, they can still be a bit wetting during the night, hopefully going towards dry by 6 years old. But after that point, it becomes, they actually need to see if there's a reason behind it.
Okay, wow. Well, I've just learned something new, so that's good to know.
That's what I'm here for.
Now, I really wanted to ask you about prolapses. So it's the kind of thing like so many women talk about, and it's kind of one of these things. It's like the dreaded thing. Like everyone's like, oh God, you don't want to get a prolapse. But like I said, I still don't understand like what actually is a prolapse.
Okay. So we are trained to that when someone says the prolapse word to us, we can say it back to them. Before that, we tend to say structural changes, structural integrity.
Okay. It doesn't sound as scary.
Prolapse, yeah. In terms of prolapse, when things downstairs don't sit quite as snug as what they used to.
Okay.
So essentially, the structure that tends to get affected is the vaginal wall, and it means that either the bladder or the bowel is kind of angling in towards the vagina, and then the vagina is coming down a bit. So it's coming down towards your knickers thing. So, yeah.
How does that happen? Like, what's the kind of things that would cause that to happen?
Anything that's straining or stressing the pelvis.
Mm-hmm.
So acute kind of strain is unfortunately childbirth.
Mm-hmm. Yep.
And that's why we exist, to educate how to do it well and how to manage it well.
Mm-hmm.
But long-term straining is more of lifting poorly, carrying extra weight, unfortunately.
Yep.
Long-term coughing, so someone with emphysema or strong asthma, that's why we encourage to get on top of it, because it can cause a problem to downstairs. Straining to empty the bowels is quite common but easy to be fixed.
Yeah.
And then kind of down the track, when you start to think of hormone changes, either with pregnancy in yours and I kind of stage in life, or later on when it becomes menopause changes. So,
okay.
Yeah.
Wow, that's a lot. So how can we, is there any ways to manage it? Like when you do have a prolapse? Yeah.
In terms of how to, I guess a step before that, how to recognize it when it may be possibly a problem.
Yep.
Is it feels like a tampon hanging out is the easiest way to describe it.
All right.
Or when there's an aching or a bulging downstairs, or when you've got a weird abdominal ache that doesn't quite make sense. It's not kind of bowel or food related. So management, there's us and there's medical. So we as physios are inherently conservative. We will always go, what can the muscles and the structures do better?
Yeah.
So pelvic floor exercises, come in and have a chat and get to know how to do them well.
Yeah.
And get checked occasionally over life of how to do them well as your life changes.
Yeah.
Good bladder and bowel habits is key and essential. Some other things, conservative things that can help are biofeedback, so devices that can be put in the vagina and help the pelvic floor to be a bit more better trained. And physios can also supply pessaries, which are like a tampon kind of structure or like a circle that sits against the vaginal wall and props up the prolapse. So it bothers you less. It doesn't necessarily fix it, but it bothers you less, and you can use that as time to strengthen. And then there's the medical route, which would be medication or that horrible S word called surgery. But we do our best to stay away from that.
And that's what I love. Like, that's why, like, it's like that first line defense, you know, it's kind of like, if you can do everything yourself without having to have all these massive surgeries, then why wouldn't we? And like, if we can try and do these little things from home, you know, it saves you a lot of pain later on and discomfort.
Absolutely. So in terms of prevention, physios exist for prevention.
Yes.
So learning how to do your pelvic floor exercises well.
Yes.
So just simply reading or seeing how to do them. Most people will still do them incorrectly.
Yeah.
I always say it's good to come in and have a chat twice with us, once to learn, and then the second time to just check that you've learnt correctly and you remembered correctly.
Like, do you find there's a lot of misinformation about the pelvic floor exercises? Like, women come in thinking, like, you know, they hear about the Kegels. They're like, oh, I'm doing this, I'm doing that, I know what I'm doing. And then when you actually kind of, I suppose, examine them, you're like, you're actually not doing them correctly at all.
Unfortunately, yes.
Yeah. Only because it happened to me. That's how I know. So, like,
exactly. You and I had this conversation.
I know.
And that's why we exist. And there's kind of two brands of people that come in and do it poorly. One is our mum's generation that may have learnt it poorly.
Yes.
There's been more studies in the last couple of decades to prove that our words are important.
Yeah.
So we have changed our words of how we get it going.
Yes.
And then our generation is quite used to Les Mills classes that work at full power and full capacity. And the pelvic floor is not like that.
Yes. Yeah. Oh my gosh, yes.
it's more talking to an endurance set of muscles than a powerhouse. And I think that's a game changer. When people understand that of our generation, they go, oh, okay, I need to work this differently. How do I do that?
Yeah.
Yeah. So that's best way in terms of preventing prolapses. Other ones are avoiding what I just said earlier. So keeping active to keep the weight off.
Yes. Yeah. Yeah.
Easier said than done. And when you've just had a kid, it tends to be about priority, 15.
Yeah. Oh, I know. And I just set, yeah, I had to set like little reminders in my phone to do like my exercises, or like to remind me, because it does. It just kind of goes to the back of your thing. And that was the only way I would set reminders in my phone. And like, it was usually when I was driving or something. And like, there's literally, once you start doing it, I'm like, okay, there's actually no excuse. Like, it's not like a proper exercise. Like, we don't need kids around you. Like, there's no excuse once you start doing them and you see the results. Like, it's just.
Yes. And there's research to prove that auditory reminders are good and helpful. So yes, your phone alarm going off, but the other one that I can suggest, and once I say it, most people will kind of go, I can't unthink that. When the kettle goes off, when you boil the kettle, the sound of the kettle can be enough to go, oh, I should do my pelvic floor. Now that I've said that.
That is genius for mums out there who are making how many coffees?
Next week.
Yeah, how many coffees we make. Like.
Or formula or whatever. But
I know.
Auditory response override being a busy mum. So an auditory reminder is good.
Is it true that like if we do enough pelvic floor exercises, it kind of becomes a bit of a muscle memory as well, like later on?
Yeah. There are components of it that are more of a reflexive thing. They're an autonomic kind of thing. And yes, once you get back into sync of learning how to work them right, then yes, it becomes better. And as much as we say, in terms of how to work them well, in terms of the words of squeeze and lift, some people, once they have been working them for 6 months or so, they automatically do them well and don't need to say squeeze and lift each time, if that makes sense.
Yes.
They just go, oh, I'm doing my pelvic floor. Oh, I'm much more in sync with it. Oh, that's where it is. I'm doing it correctly. Yeah.
Because I found that myself. I remember it was honestly, it was lifting the kids in the car, lifting the toddlers in the car. And I remember you told me like, you have to make sure you kind of do it. And, and honestly, I still do it. Like my kids, pretty much get in themselves, and I noticed myself still doing it. And I'm like, oh my God. So it's like that must be that muscle memory. Like I still automatically do it. Like, do it and to prevent it. And I remember you kind of warning me, like, unless you do this, like, you're not gonna be able to lift those kids in the car again. And I was like, oh my God. It was like, but it's true and it's worked.
Yep. That's exactly the one that becomes the primitive reflex. Yeah. So that's what we call the knack, when your pelvic floor works when you move quickly or do something quickly, like cough or sneeze.
Yep.
And that's the one that's actually proven that if you do it well for about 21 days, it becomes a muscle memory. Yes. The other active thing to do to maybe reteach yourself, so when your kids were young, your extra bit that you could have done would have been squeeze and lift, work the pelvic floor. But when you know you need it, so putting the kids into the car, go squeeze and lift. And then I tend to say zipper up. So zipper is going from the back end to the front end.
Yeah.
So you've activated the entire kind of abdominal wall.
Yeah.
Squeeze and lift, zipper up, and then do what you need to do. Quick, short cues work for the pelvic floor.
But it's fantastic, like you said, 21 days, and that's all it really takes. Like
for that side of it, yes. For the pelvic floor, we encourage that it be done daily for the rest of time.
Yeah.
But yes, you do get more strength, you get more endurance, you get more power. And yes, it becomes part of your daily life, that it comes along with you and works better. And
yeah. Oh, so we mentioned before, we were saying about the different terminology and the different types through the generations about what our mums do and what we do. And did you find that there's so many kind of, you probably hear these myths from different generations, that it's kind of normal to be, have continence issues after having children? And I find myself, I remember I was literally wearing a continence aid with Maeve, and I was struggling so much. And then so many people, my mum and my mother-in-law was like, oh, but that's normal. When you have kids, that's normal. You can't jump, you can't do this. You're just going to you wear yourself. That's what happens. And then when I came and saw you, I almost cried, because I'm like, okay, that's actually not true. Have you found so many women finding that?
My instant response to that is it's common, but it's not normal.
Okay,
and as soon as you say that to people, they go, oh, there's something I can do about it.
Yes, yeah.
Yes, it is definitely the few generations above us that say, yes, it's normal. No, it's common, but it's not normal.
Yes.
At the core of it, the bladder itself is a muscle.
Mm-hmm.
Yes, it's got lining and fancy stuff on it, yes, but it's a muscle. And the pelvic floors, they're a muscle. They can be worked. That's why physios exist, because muscles can be retrained.
Yes.
So yes, there's ways to get around it. It's common, it's not normal.
Yes. That's amazing. I remember when I saw you, because that's the thing. I think I went and saw a different physio at the hospital, and it was kind of one of those things where they kind of like shrugged it off, and I was just almost in tears because I was 29 and I was like, I can't be incontinent for the rest of my life. And I was like, but then like, that's the thing, you speak to this other generations, and it kind of makes me sad as well that they never had that opportunity to kind of go and see someone and be actually like, do you know what, we can actually help you.
Yes. This world of physio we are essentially standing on the shoulders of giants. There is so much research to prove what we do works at the moment.
Yeah.
And it is moving lightning fast in terms of the last decade of how good we can get patients. So yes, yeah.
But like like you're a mum yourself to 3 kids now.
Yep.
Yep.
And tired.
I know. No, and you're fantastic at what you do, you know. But did you notice, obviously, 3 pregnancies, you know, 3 kind of mothers groups and all the antenatal classes, postpartum classes. Did you notice the lack of education and kind of advice about pelvic floor health when you were pregnant and after having your babies?
Absolutely. I definitely noticed it the day that I was sitting with my mother's group, and a few guest speakers came in and chatted when they left the room, and then I piped up and answered a lot more of their questions.
Yes.
And the girls looked around me and went, oh, you're so much more helpful.
Yeah.
I mean, there is so much misinformation out there. There's quite a lack of it. In terms of relevant to that, I guess the biggest things that I tend to push of, if you're just a bit kind of stuck in a muddle, come and see us, yes, but also online. Continence Foundation of Australia.
Okay.
It's a fabulous website and heaps of resources. Pelvic Floor First is similar. It's kind of under the brand of Continence Foundation. So much information, so much more out there. We just need to brand well that it's out there.
Yes, yeah.
We are the generation that is trying to change the talk.
Yeah.
and put it out there of we can help. Yeah, we need to see women earlier rather than later.
Well, women have no idea. I had no idea there was even a physio there was actually specialised in pelvic health. I didn't even know. And we were the same thing. We had a physio come, and they were more interested in obviously the babies, which is fine. But when you're sleep deprived as a mum, it's really hard to find that information. And like, I kind of think mothers group should be, like you said, if someone doesn't come in and talk to you, but they should be kind of handing out these flyers of these websites where you can actually go and find the information yourself. You know, I think it's so important.
Yes, absolutely. And I mean, I've been pregnant in COVID times as well, so that's its own fun in itself. So then you've got the angst of, I don't actually want to physically leave the house. I don't want to take my baby with me.
Yes, yeah.
How can I do it better? We, as health professionals, are now so much better at telehealth.
Yes.
Better at having a chat, emailing, calling, whatever, checking in with our patients if we know they're out there. If patients are just a bit anxious to go out and see people, then online, a reputable brand online, so the Continence Foundation is good. Then I get patients instantly to jump on that. There is so much information on those sites that's good, solid, research-based information.
That's what we need. So do you suggest as well for a woman to see you when she's either pregnant, that 6-week postpartum checkup, or like later on in life? Like, what is probably the optimal time for them to see you?
All of the above. always the earlier the better. I'm actually finding that when teenagers come through and they're quite receptive, that's the perfect time to get them started. Get them started understanding where their pelvic floor is, get them strengthened before life kind of gets in the way. And educate them and prevention of future problems. In terms of around childbearing years, my encouragement is the single best contributor to postnatal continence is antenatal pelvic floor. So keeping us women dry after we've had the baby, the single biggest precursor to it is doing your pelvic floor when you're pregnant. So if that's not encouragement to come earlier rather than later, I don't know what is.
Yeah, 100%.
And
dry. Yeah, and I wish I had that encouragement, and I never got that with both my pregnancies. So I feel like it's something as well that needs to be pushed as well. Like it needs to be included.
We're getting the word out there, and we're essentially starting to almost push as, let's do like a healthy pregnancy session, either one-on-one or in a group, and learn how to do it well. Yep. Seeing when they're pregnant generally tends to be when they're in pain, like with their back or the pelvis, and we just use that as a little interlude to kind of cover the rest. But we'd hope to see someone to learn their pelvic floor well when they're pregnant, and always definitely at 6 weeks after. Even if it's second or third kid, essentially that mum is presenting as a fresh new patient again. Their body's changed again.
Yeah, and their body's gone through this massive trauma, and I remember I think that's the difference is you go to your doctor and you have this 6-week checkup with your GP, but they don't, like for me, they never really checked you properly. Like, they would check your scar and how are you going? And they're like, oh, you're good to drive. You can go back to exercising, you can have sex, you can do all these things. But like they never properly checked. And that's when, and then I've been saying to women, I'm like, honestly, go and see a physio about your women's health, like at 6 weeks as well as the GP, because the check they will give you is so much more, I don't know, like more detailed, and so it's crazy.
Yes, and specific to the patient.
Yes,
we are getting the word out there quite solidly with the doctors. I gave 75 referral pads and information sheets out to all the doctors in the last couple of weeks. Yes, we are being a bit noisy.
That's fantastic, and that's what we need. That's what we need. Exactly. Because at the end of the day, can most continence issues be solved with seeing like a pelvic floor physio?
They can be very much enhanced. There is so much information that we tend to cover, particularly in 3 sessions. So yes, the first appointment is quite a blur, talking about shapes, but then most patients find that the penny kind of drops at about treatment 3. They go, oh, I've put everything into place. I understand what I'm doing. And, oh, I'm a bit drier. Oh, my pain's easing off.
Yes.
So 3 sessions isn't that long in the scheme of things.
It's not for your lifetime. And that's the thing. So many women kind of believe that the first line of treatment will be a surgical intervention, and it puts a lot of women off. And then that's why I'm hoping listening to this, they're going to be like, okay, it might be able to be helped by seeing a physio instead of going to that first line of surgery.
Yes. And we are primary health professionals. We are allowed to be the first port of call. We don't have to have, a patient doesn't have to be referred to us. They can walk in and we be the first person to meet them, which means we are trained to spot when there's something that needs to get us to blow the whistle and tell the doctor. We are trained to spot that if there's a flag or something wrong, yes. But even if that patient ends up choosing to go down the surgery route, having a strong pelvic floor and having good bladder and bowel health knowledge puts them light years ahead of everyone else in terms of recovery, even if it comes to that. But, it's so often that, the education is, oh, it has to go down the medical line, it has to end in this. Not necessarily. Conservative is key a lot of the times. So.
And I wanted to this is one that's really, really always interested me, is ab separation. Like I heard it so much postpartum and I still don't understand like kind of what it means. And I had a cesarean, like, emergency cesarean, and I still don't really understand. They talk about this ab separation before you go back to exercise, but like I still don't even understand what that actually means.
So the abdominal wall has 4 muscles to it. So your deep core muscle is your transverse abdominis, and he sits horizontal, kind of like a corset holding everything in. Then you've got internal and external obliques. So when you do sideways sit-ups, they're the ones that work. The outside tummy muscle is rectus abdominis. He has fascia in the center of him that's called linea alba. And when you get pregnant, it's designed that the muscle actually spreads out to the side and the fascia stretches. That's what it's designed to do. If you're an Olympian and heavily toned, then obviously things happen to the muscle and the muscle is not the best.
Yeah.
You want it to stretch. You want it to support the baby. And when we see women at the end stage of pregnancy, sometimes you can actually palpate the muscle is hanging right out on the side.
Far out.
So our tummies are designed to stretch, and likewise they're designed to come back in again.
Yeah.
So that fascia that we check.
Okay.
We worry when we can stick 2 fingers in that after a couple of months.
Okay.
So when patients come in and go, oh, I've got abdominal separation, they checked it in the hospital, they checked it at 1 day postnatal, and oh, they could fit 3 fingers. I mean, that's relatively normal.
Okay.
The body will come back of its own accord within 6 months anyway.
Yeah.
We just do what we can to boost that and boost it well.
Okay.
So yeah, we routinely check it, and that's why the 6-week checkup exists, because that's about the time to start working on it if it's not coming back in together itself.
Okay.
And there's exercises and management that can be done. But yeah, we tend to check of just how many fingers can you stick in the gap, or if there's a gap, and work accordingly. The evidence for that changed a lot in COVID times. British versions of me were stuck in an awful lot more lockdown than Australians were.
Yes.
And put an awful lot more research into that rehab of the abdominal wall, and worked out that it's not about the gap, it's about the depth. It's about how good the fascia is, how good it is, what you've got to work with. And yeah, it's good that there is quite a bit of change around the talk in the last couple of years, because yes, the fear is often, it's not the recovering from the childbirth, it's not working out the baby, it's actually worrying about the tummy, which is coming back together of its own accord anyway.
Yes.
So just a bit of education goes a long way.
That's fantastic.
And just a bit of encouragement. Anyone trained in it and knows how to check it can just go, no, it's all right. It'll come back of its own accord. And patients just go, oh, thank you.
Yeah. And that's what we need sometimes, just that reassurance, especially like first time mums, and they have no idea our body has gone through so much. And then it's like, it's okay. It's normal. Like, it happens to a lot of women. Like,
I've heard it called the cloak of care. And just thinking as a good health professional, to just be empathetic and be comforting of patients, it works wonders.
Yeah. Just
to actually be heard and listened to and go, no, it's all right.
Yes. Yeah. It's amazing the relief it feels like, oh, I'm not the only one, It's like,
yeah, absolutely.
So women who've only had C-section births, do you still recommend them to come and see a physio regarding their pelvic health? So even though if they have never had a vaginal delivery, will they still have had pressure put on their pelvic health, like pelvic floor?
Never underestimate the effect of a pregnancy on the pelvic floor, because it tends to be a long-term, obviously, thing. 9 months of that amount of load against the pelvic floor. But also the other question that I always routinely ask is, did that mum labour at all? Did that mum have an emergency, or was it planned? Were they like me and they got to 9.5 centimetres and then they copped a Caesar anyway?
Yeah.
That makes the management totally different. That patient has essentially gotten the worst of both worlds and needs to be managed accordingly. So yes, the pregnancy will always still affect a pelvic floor. But yeah, in terms of the recovery, we talk about pelvic floor with a C-section recovery, even if it's a booked in Caesar. But there's always extra little things that we need to cover from that perspective anyway. It becomes abdominal surgery, so you need to think about abdominal exercises, so specifically how to manage those muscles that are knitting back together, how to manage the scar tissue, and then a bit of education in terms of how to do things correctly, like lifting a bit differently and not guarding too much. And then the one thing that tends to get missed is a lot of mums that have Caesars will be quite hunched and quite guarded in terms of that. And we just think in terms of opening up the shoulders and working on the mobility of the upper back, it's a game changer.
Yeah. It's not a joke, the recovery. Like, I've had a vaginal birth and a cesarean birth, and I tell you what, the recovery of a cesarean is no joke. It is, especially when I had
not the easy way out at all.
Oh my God. And I had a toddler as well. I was just like, this is horrendous. Like, it's hard. Like, birth is hard in general, but my God, it was rough. The recovery was hard work.
Yes, absolutely. There are 7 layers cut through, and they're all stitched back up together, obviously well and separately, yes, but that is an awful lot to recover from when you've already like been pregnant for ages as well. It's not like you just went in there straight anyway.
And then you're expected to get up and then look after this tiny little human, like, you know, like normally major abdominal surgery, it's like, you know, you're bed rest, you do this, you do that, you can't do anything, you can't lift anything for 6 weeks. And it's like, oh, hold on, here's your baby, see you later. And it's just like...
Yep. And then have a photo for the paper. And I think that's about the time that you just crack.
And all the family walks on in. You're like, oh my God.
Where's the makeup?
Yeah. So what are some things that physios who are like working in the pelvic health field like yourself, what can they do to help with that postpartum period?
In terms of recovery overall, or in terms of...
I suppose with the recovery period, is there anything that the pelvic health is doing at the minute that can help you in that postpartum stage?
Immediately postpartum, we tend to encourage kind of check back in with your pelvic floor, see that it's working, what it's doing totally differently. It won't hold for too long.
Yeah.
And the main things I tend to educate, honestly, are actually bladder and bowel at that point.
Okay.
So bowels, don't underestimate the effect of medication.
Okay.
And Caesar delivery mums, we worry about that a little bit more because...
Like the analgesics and things like that, like, and being constipated, and like the pain medications and being constipated and...
Exactly. The side effect of the pain meds is constipation generally, and you don't want that mum to strain.
No,
I'm starting to actually get mums to quietly pack a little can of peaches or pears or something in their hospital bag, so they've got a food version to get things going, rather than, oh, I'm a bit stuck, give me a medication to get things going. Immediately recovery as well from the bladder perspective. A vaginal birth, it can be quite intimidating to pee. It can be a bit stinky, it can be a bit off. So my quick and easy suggestion is grab a pump bottle and literally have it by the side of the toilet and shoot as you're peeing. It makes it easier to pee because you got the sound of water. But it takes that sting away as well.
I think as well it's a mental thing, isn't it? Like, you know, you think, oh God, it's going to hurt. And then it's just like, you need to have a wee, but it's like, oh God, the same with the first time you have a poo after having a baby, you know, it's like going to be painful, but you have to do it. And you're like, oh God.
Clean up and hold your bits and bobs in together. And then once you've done a poo, great, you can leave. Oh, really? I guess the other, just a kind of a warning as well, I tend to just give, midwives would do it as well, in those first couple of days in terms of the bladder. The little extra thing that kind of sets a postgrad physio apart from an undergrad is thinking about, is that bladder not doing the right thing after birth? So a Caesar, some organs essentially get pushed out of the way and they get a bit traumatized coming back together, but a vaginal birth as well. You just want to make sure that in those first few days, what a mum is peeing matches what she thought she was going to pee. As in, what the amount coming out matches what she thought it was, particularly if there's reduced sensation. If she pees out quite a lot, and she thought it was just a little amount, then just, let us know, let midwives know, because that can be managed quite quickly and should be.
Okay, that's really interesting. Yeah, and that's interesting. That can be managed by you guys as well, getting onto it quickly.
Absolutely. Yep.
So do you believe as well that kind of like regular exercising can actually contribute to good pelvic health, like doing the correct exercises? Like, you know, I found when I was seeing you, I was struggling with my pelvic health and I was seeing you, and then I got a personal trainer and she was able to give me like the correct exercise to do that was safe, you know, post-cesarean. And I don't know which one it was, but in my mind, I feel like it's a combination of both that actually encourage my pelvic health, you know, by doing these correct exercises and strengthening my body.
Yeah, to a point. My encouragement for the first 6 weeks is general fitness. Focus more on just fitness, just moving. And coming back in touch with the pelvic floor. After the point of women getting their tummy checked, then yes, we can start to educate them specifically on exercises to work the abdominal wall and strengthen their back and their tummy.
Yes.
But just getting moving. A lot of women just get stuck in the fluff of newborn life, which is lovely and it's fun and they're cute.
Yes, yeah.
But just don your sneakers and go for a walk.
Yep.
The pelvis has to move so much when you're just simply working. So it's toning anyway. It's helping things move. It's helping get the weight off as well, which will help things.
Yeah.
Recovery. But yeah, we are well and truly trained. Every physio is trained in how to exercise a patient well to recover from birth. Yeah.
That's so good. So if mums are, like I said, they're coming to see you and they want to start exercising again, you're able to tell them what's safe to do and what's the best way, you know, and because it's quite daunting, you know, when you've just had a baby, you're like, what can I do? What can't I do? You don't want to start doing jumping jacks and skipping, you know, it's kind of like what's going to, you know, we want to do something that's going to help like our pelvic floor.
Yes. That's what we love doing. We feel that we're good at it as a profession.
Yeah.
Yes. And there is so much research to prove what works as well. The latest one is an international article that's been sent out that goes through correct ways of getting back to running and kind of gives the breakdown of how to achieve it bit by bit and kind of interval training and such things. So just to be told that there's research that exists to prove what we're doing works.
Yeah.
Patients are so much more relaxed and go, okay, good. Let's tick this one off the list and this one and this one.
Yeah.
All right, I've got a time frame.
Yes.
Good.
Now, is there anything that we're doing? Like, you know, we all form these terrible bad habits. Is there anything that like we're probably doing that like bad habit, everyday things that are actually bad for our pelvic floor that you can think of?
The single key one that I tend to address first time I ever see a patient is straining to empty the bowels.
Okay. Which probably a lot of mums do, you know, so.
Yeah. It's almost like taboo to talk about it in general public, but we're welcome and free to talk about it now.
Oh, so this is real mummy. We're talking about all things, you know, no matter how gory, no matter how real.
Let's talk about how to poop correctly. So the main things are in those early first few weeks of having a baby you just tend to grab food and eat in the run and it tends to be one-handed.
Yep.
So you just want to think about your food choices. If it's grabbed, then at least keep a kind of an even amount of wet and dry food. Mm-hmm. So wet being your fruit, your porridge, your things that keep stuff flowing through well.
Okay.
So yeah, keeping the food choices good, not skipping meals, so eating fairly regularly. And then in terms of the position to poop.
Yes.
Has changed in the last, it's definitely changed since the first time I went through uni 17 years ago. That used to be talking about the wide mouth became a wide anus.
Yes.
A bit horrible to talk through with the patient. Now the correct way of how to poop is to brace and bulge. So brace means that you lean forward. So you always lean forward to poop and sit upright to pee.
Yes.
So brace, lean forward, arms resting on your legs, so on your upper thigh. And if you're vertically challenged like me, you probably need a step. My extra logic to patients is you've just pushed out a kid that's going to use that step to stand on to brush their teeth until they're 8. So it's a worthwhile investment. But the step just means that the knee becomes a bit higher than the hip, so it's about 10 degrees bend. It just means that one of the main pelvic floor muscles at that point is switched off.
Yeah.
So she releases in order for the bowels to work. So we tend to say brace, yes, but brace and bulge. Bulge means that the belly is pushed out, so you bulge out your belly.
Yeah.
Much more like thinking about a toothpaste that was a bit stuck. You're not going to kind of shove the end of the toothpaste. You go back up and go.
Okay. Yeah.
And then it releases down the bottom. So yeah, that's one of the core things I chat about the first time I meet nearly every patient.
Yeah.
Stop straining and how to go about stop straining. Yep. The other things that are not particularly helpful that we could enhance our pelvic health is drinking enough water.
Oh, yes. Yeah.
Medical professionals that they are, the doctors tend to worry when patients drink less than 1 litre of fluid, but we as in pelvic health land tend to worry when a patient is less than 1.5 litres.
Yes.
It tends to make them a bit more irritated. So in terms of good bladder habits, my suggestion is 1.5 to 2 litres of fluid, with hopefully quite a lot of that being water. So I tend to, instead of saying it's caffeinated or something, I would say it's kind or unkind fluids.
Yes.
So you want your kind, calm water and herbal teas and stuff to be more than 50% of that. Other things that help enhance or that can be done that aren't good for the pelvic floor. I'm going to think about lifting. So just lifting too much or lifting awkwardly. One of the key ones that we do every few days is lifting all the grocery bags at once.
Yes, yes.
Not entirely great, even if you do your squeeze and lift and zip her up. Just do it in stages and just learn how to lift correctly. Even if it's just for a time that you're having to reset your mind while things are recovering, then good, but at least to acknowledge it. And the main core is be compliant with pelvic floor exercises.
Yes. I think for me, I had to ask for help because I was so stubborn. I was like, I can lift that, and I'm like, especially in that postpartum period, I was like, I don't need help lifting this in the car, because I'm so stubborn. But I'm like, actually, no, like this is the time where I'm like, I need to ask for help for it, otherwise it's going to affect me a lot later on. So I was like, actually, yes, you can lift. I have to go and help. Can you help lift these out the car? Can you lift this in the car? As much as it killed my pride, like it helped my pelvic floor.
Yes. The first 42 days of having a new baby, we are encouraged to ask for help. It's just whether or not we acknowledge that and say yes.
So mums listening, you've done your hard yards. Let dads do the lifting, okay? Like this is from professional. Let the dads do some lifting,
I think one of my best friends in those first few weeks was the lovely guy at the Coles checkout because he lifted my bag in.
It's the little things. Oh my God. And that's the thing. Like if you're listening to this, And so what are some of the benefits of the good pelvic health that we will like later on in life? So obviously, like if we're practicing good pelvic health, are we less likely then to have a prolapse later on and incontinence issues if we're kind of looking after our pelvic floor now?
You'd hope so. So my kind way of saying that would be it keeps things snug downstairs. Stops things from heading south. So yes, technically reduces our chance of prolapse in the future, but yes, keeps everything nice and snug and taut. Yes. So there's benefits for focusing on pelvic floor strengthening in that's going to reduce continence dramas, prevent prolapse, yes, but enhances sexual function as well. Nice toned pelvic floor does help in the bedroom.
We're all here for that. So.
So that's specifically in terms of pelvic floor. Specifically in terms of bladder, reduces the chance of incontinence, so leakage, or urgency, which is rushing. So there's essentially two brands that we tend to focus on, but good bladder knowledge can help them. And then in terms of bowels, you want to essentially keep the pipes clean and keep them running through. And we worry when someone's pooping every 3 days or less often. So normal's a relative thing, but it's pooping between 3 times a day to every 3 days. But essentially constipation is a subjective thing. If you feel constipated, then you probably are and you should act on it somehow. One of my top line postgrad lecturers used to just nut it out of just encouraging that there's 5 main effects on the bowels. 2 of them we tend to forget about. So food, drinks, we think about that. We sometimes think about activity or forgetting to exercise. But the other 2 are medications. They can be clogging and emotions. Just feeling like the world is just getting on top of you when you've got a newborn baby that suddenly wants you all the time. And go, okay, why am I getting constipated? Maybe I actually just need to relax into this and my bowels will help to work a bit better. Stress not unheard of.
Stress would put a lot of pressure.
I'm just thinking through that I've talked around it, but haven't talked specifically in terms of how to work a pelvic floor well.
Oh, no, please. That's why we're here, so.
Yep. So, like I said, just simply hearing it from someone or seeing it written is not ideal, but it's worse of things. Just a bit of knowledge is a good starting place, and then just encouragement to come and check with someone who knows how to assess it. But thinking that the pelvic floor is a set of muscles that live about 4 centimeters internal. They sling front to back, side to sides, and they hold everything up. So hold bladder, bowel, vagina, everything in place, and they allow stuff to flow on through. So they allow waste to flow on through. So the words that we tend to encourage women to get their pelvic floor to work are squeeze and lift. So squeeze becomes the closure, the stopping wheeze, stopping wind. Lift is imagining someone's got a little gold string on the inside of your pelvis and they're just giving it a gentle tug, or lifting your bits up off your knickers, or lifting your bits up off the chair. The simple talk works. If squeeze and lift is not working for a mind, then simply saying stop stop wind. One of the best ones that gives everyone a little chuckle, but then they do it well, is imagine like your vagina is a straw and you want to suck up strawberry milk through the straw. So yeah, that works for those of us, a lot of health professionals that live in their head and they're trying to overthink it. No, just a straw suck.
It's funny you're saying this because it's like muscle memory. Like as soon as you're doing this, it's like straight. I'm like, oh, doing my pelvic floor exercises. Like, it just jogs you through. And I was like, oh, yep. So mums, if you're listening, I hope you've done some while you're listening to this.
I can always see eyes when I'm training this in a group. You can always see the eyes of the people that are doing it.
The concentrating eyes.
What types of muscles to work with in there? There is 2 types of muscle fibers. There is fast and slow. So fast is ones that kick in when you cough, sneeze, laugh, jump. Slow is holding your bladder well so that you can get to the toilet in time, which may be a couple of minutes. So we tend to encourage patients to work both. So to work the fast ones, just to do a squeeze and lift and relax. And then also the slow ones of a squeeze and lift and hold it while you're still breathing, but hold it for a time. In terms of the general guidelines for what's good postnatal, and this has come into effect last 4 years or so, is the general guide of how many reps that are safe or good to do is 1 repetition of pelvic floor per day postnatal.
Okay.
And then the hold time will become 1 second longer per week postnatal until both of those hit 10. So 10 days postnatal, you should be able to do 10 fast repetitions, and 10 weeks postnatal should be close to being able to hold for 10 seconds.
Okay, wow, yeah.
Yeah, I know it's a lot of information, but I hope it's clear enough.
Well, I think so. And I think sometimes that's why I'm like, I hope mums are listening to this. So if mums are a bit nervous to go out and reach out, or maybe they don't have a physio in their area that specialises in pelvic health, like we're blessed that we have this in our town, but some mums might not. And that's why I'm hoping like listening to this, they might, be able to wrap their head around it a little bit more and, have a go. Suck up the milk. So.
You have a strawberry milkshake, you'll think of it.
Yeah. Now whenever the kettle goes off, I'll be like, oh yeah, like exercises.
Short little small cues work the best, and overriding someone that's overthinking it, just giving them something so simple tends to be so helpful and helpful to remember it each day as well. So
definitely. So as a mum, so you're a mum to 3 kids and a health professional. Now, what is 2 bits of advice you would give to new mums on their postpartum journey as a well-experienced mum yourself?
1, I think it screamed loud and clear, don't strain to empty your bowels. Learn how to poop well. And then the other one is come and say hi at least once.
Yes.
Come and just get someone who's trained in the field of pelvic health to just pick their brains. Generally, minimum twice I'd hope for, but at least once. Come and say hi and learn how to do the pelvic floor well.
Yeah. Now, for people who are listening, obviously, like we're based in Australia. So I was lucky enough to see Yvette at Kambana Bay Physio. If you're around that area, it's fantastic. There's so many help there. And yeah, Yvette was absolutely brilliant. But like I said, if you're not around, try and find out your local physio clinic and yeah, have a look for women physios who specialise in the pelvic floor area. Because like I said, it is a speciality. And yeah, I would 100% recommend it. It changed my quality of life an amazing amount. And I feel like it's something every mum really, really needs to do. And yeah, it'll change your life.
Yep. We exist worldwide. Yep. And called the same thing in each of the countries, actually. Pelvic health physio, pelvic health physical therapist. Yep.
Well, thank you so much.
Yeah. To help anyone at Kambana Physio. Yep. In Bunbury, there's about 4 of us in Greater Bunbury. So yeah. Yep.
So the resources are out there. We just need to get them out there. So thank you so much, Yvette, for coming on and sharing all this amazing wisdom and advice for us all.
More than welcome. Thank you for having me on.
Thanks, Yvette.
Thank you so much for tuning into this episode of the Real Mummy podcast. Remember, every mum's journey is unique and you are doing an amazing job. Please be sure to like and subscribe so you never miss out on new episodes released every week. Head over to our website at www.realmummypodcast.com to stay up to date with the latest episodes and dive into our recent blog articles filled with even more mum wisdom and stories. We absolutely love connecting with our listeners, so don't forget to follow us on social media. You can find us on Instagram, Facebook and Twitter at Real Mummy Podcast. Join the conversation, share your thoughts and become part of our supportive mum community. And I'd love to hear from you. Got a topic you want covered? Know a guest you'd love to hear more from? Reach out to us through our website or social media. Your input is invaluable and helps us create the content that matters to you. Thank you for being part of the Real Mummy Podcast family. Until next time, stay strong, stay kind to yourself, and remember, you're never alone on this journey. You've got this.